Hello everyone, welcome to my channel Learn in Minutes, and the topic for today is diabetes mellitus. I will be covering up the topic under the following outline: definition, classification, characteristic features, complications, diagnostic criteria and treatment. Diabetes mellitus can be defined as a clinically and genetically heterogeneous group of metabolic disorders sharing the common underlying feature of hyperglycemia, along with alteration in carbohydrate, lipid, and protein metabolism, as well as secondary damage in multiple organ systems such as heart, eyes, kidneys, nerves, and vascular system. Going on to the classification of diabetes mellitus. Diabetes can be classified into four basic types. The first one, type 1 diabetes mellitus or insulin dependent diabetes mellitus. The second, type 2 diabetes mellitus. The third includes other specific types of diabetes such as diabetes due to genetic defects of beta cell function, due to genetic defects in insulin action, also due to diseases of exocrine pancreas such as pancreatitis, trauma, neoplasia, and endocrinopathy such as Cushing syndrome. Fourth one is gestational diabetes mellitus, also known as the diabetes that occurs during pregnancy. The classical symptoms of diabetes mellitus includes a triad of polydipsia, that is excessive thirst, polyphagia or excessive hunger, and polyuria or excessive urination. Other characteristics that differentiate type 1 and type 2 diabetes mellitus include age of onset. Type 1 diabetes mellitus is less than 40 years and type 2 greater than 40 years. The duration of symptoms for type 1 is days or weeks, whereas type 2 is months or years. A positive family history is always associated with type 2 diabetes mellitus. The body habitus for type 1 is normal to wasted, as that of type 2 is obese. Pathogenesis is autoimmune beta cell destruction for type 1, whereas type 2 includes insulin resistance, impaired insulin secretion, increased liver glucose production, etc. And acute complications for type 1 is ketoacidosis, as that of type 2 is hypoosmolar coma. Type 1 is usually responsive to insulin therapy, whereas type 2 is responsive to resistant to insulin therapy. Going on to the complications of diabetes mellitus, they can be categorized as acute complications as well as chronic complications. The acute complications include diabetic ketoacidosis, hyperglycemia, hypoglycemia, diabetic coma, respiratory infections, and periodontal disease. The chronic complications can be further categorized into microvascular complications that include diabetic cardiomyopathy, nephropathy, neuropathy, retinopathy, and encephalopathy. Macrovascular complications that include coronary heart disease, diabetic myonecrosis or muscle wasting, diabetic peripheral vascular disease, and stroke. The diagnosis of diabetes mellitus can be done by any one of the three methods: the random blood sugar, the fasting blood sugar, or the 2-hour postprandial blood glucose level. The symptoms of diabetes mellitus plus a casual non-fasting plasma glucose or the random blood sugar taken any time of the day, if greater than 200 mg per dl, is diagnostic of diabetes. Fasting plasma glucose greater than 126 mg per dl is diagnostic of diabetes mellitus, that should be done at least with no calorie intake for 8 hours. And 2-hour postprandial glucose greater than 200 mg per dl is diagnostic of diabetes. But whatever method is used, it must be confirmed on the subsequent day by any of the above three methods. Going on to the treatment of diabetes mellitus. For type 1 diabetes mellitus, the treatment basically involves insulin therapy. So, the treatment aims at maintaining normal blood sugar levels by regular monitoring, insulin therapy, diet, and exercise. Type 2 diabetes mellitus is more a comprehensive treatment where the treatment consists of self-care, that is exercise, quitting of smoking, diabetic diet, and also anti-diabetic medication. So that's all for now, guys. If you've liked my video, please do subscribe to my channel and hit the like button.